Imagine a patient arriving at the emergency room with severe burns, their face etched with anxiety and fear, desperately seeking relief from excruciating pain. At this critical moment, their heightened emotional state makes them exceptionally responsive to influences that can either alleviate or exacerbate their suffering. Research underscores the role of hypnosis in managing burn injuries. Hinshaw, in 1963, identified inflammation as a key factor in worsening thermal injuries, and in 1959, Chapman, Goodfell and Wolfe further demonstrated that this inflammatory response is medicated through the central nervous system and can be modulated by hypnotic suggestion. Emergency hypnosis stands as a revolutionary approach for mitigating pain, anxiety, and the physiological aspects of burns. By harnessing the patient's heightened suggestibility, medical practitioners can significantly reduce the severity of injuries and enhance the overall patient experience. Imagine the transformative impact if, upon arrival at the hospital, a patient could be guided into a state of calm and comfort through their own mental power. This is the promise of emergency hypnosis. A technique that not only offers immediate relief but also supports the healing process. Emergency hypnosis involves leading patients into a relaxed, focused state where they can be more open to positive suggestions. This state enables the mind to influence bodily functions such as pain perception and inflammation. By concentrating on healing and comfort, the healthcare professionals can help counteract the body's inflammation response, which often exasperates burn injuries. Research has revealed that patients who underwent hypnosis within 10 hours of sustaining burns demonstrated markedly improved outcomes. Notably, these patients exhibited elevated urine output on the second day, suggesting better fluid balance and lower risk of complications. The rationale behind emergency hypnosis is compelling. The mind wields significant influence over the bodily processes by redirecting a patient's focus from fear and pain to comfort and healing. Their stress response and consequently the inflammatory reaction exacerbating their burns is diminished. This approach promotes faster and more effective healing. When a newly burned patient arrives in the emergency room, their mind is concentrated and hypnosis is usually easy to induce. Since the patient may be a stranger to the physician, the first communication is an introduction and a suggestion conversation that lays the foundation for immediate care and comfort. I'm Dr. X, Y, and Z, and I'll be taking care of you. Do you know how to treat this kind of burn? This question brings to the patient's attention that they lack the expertise in this area, naturally leading them to place trust in the medical team. Precise wording is crucial to avoid the patient mentioning irrelevant or counterproductive treatments, such as home remedies. No, that's all right, because we do know how to take care of this, and you've already done the most important thing, getting to the hospital quickly. You're safe now. And if you do what I say, you'll have a comfortable rest in the hospital while your body's healing. Will you do what I say? This dialogue helps the patient transition from a state of panic to one of trust and relaxation. It introduces a pre-hypnotic suggestion that reassures them of their safety and sets the stage for effective hypnotic induction. Yeah, I'll try. Emergency hypnosis involves guiding the patient into a relaxed, focused state where they become more receptive to positive suggestions. This state allows the mind to influence the bodily functions, such as reducing inflammation and pain. By focusing on the patient's thoughts of healing and comfort, medical professionals can help mitigate the body's natural inflammatory response, which is responsible for much of the damage in severe burns. Here's a practical example. The first thing I want you to do is turn the care of this burn over to us, so you don't have to worry about it at all. The second thing I want you to realize is what you think will make a great difference in your healing. Have you ever seen a person blush or blanch white in fear? Yep. You know how nothing's happened except a thought or an idea, and all those blood vessels in the face have opened up and turned red or clamped down and blanched. What do you think will affect the blood supply to your skin? And this affects healing, and you can start right now. You should have happy, relaxing, enjoyable thoughts to free up all of your healing energy. Brother Rabbit said, everybody's got a laughing place, and when I tell you to go to your laughing place, I mean to imagine that you are in a safe, peaceful place, enjoying yourself, totally free of responsibility. Let's get you relaxed and go to your laughing place right now while we take care of the burn. Here are some action steps. 1. Upon the patient arrival, the physician should introduce themselves and initiate the hypnosis by guiding the patient into a state of relaxation through focused conversation. 2. The physician should employ a carefully worded suggestion that emphasizes safety, comfort, and healing, creating a mental environment conducive of healing. 3. Techniques such as deep breathing, visualization, finding a laughing place should all be used to deepen the hypnotic state, allowing for effective pain management, anxiety, and reduction. 4. Throughout the hospital stay, the physician and medical team should continue to use these hypnotic techniques during procedures such as dressing changes, reinforcing the patient's state of relaxation and comfort. Believe in the power of the mind to influence the body. The techniques of emergency hypnosis are not just theoretical. They've been proven to make a tangible difference in the recovery of burn patients. By mastering these simple yet effective techniques, you can provide your patients with more than just medical care. You can offer them comfort, relief, and a faster path to recovery. Let the potential of emergency hypnosis inspire you to explore and apply this valuable tool in your practice. By mastering these straightforward yet powerful techniques, you can offer your patients more than just medical treatment. You can provide them with profound relief and speed up their path to recovery. Embrace the potential of emergency hypnosis and let it inspire you to elevate your practice. Emergency hypnosis offers a powerful immediate solution for managing pain and minimizing the severity of burn injuries by guiding patients into a relaxed, suggestible state. You can significantly enhance the healing process and overall experience. As a healthcare provider, you have the opportunity to redefine burn treatment by incorporating hypnosis into your practice. And I can only imagine someone as wonderful as you is constantly improving yourself. So when you start integrating these techniques, you can begin to witness the transformative impact on patient recovery. I bet you can empower your patients by unlocking the healing potential of their own mind, leading them from pain to comfort and from injury to recovery. With emergency hypnosis, you'll be facilitating profound healing, and you deserve that because you're perfect just as you are.